Hi, everybody. I'm Laura Mulcahy with Kansas City Mom Collective, and today I have the pleasure of chatting with Dr. Ina Lobeck, and she is a pediatric surgeon at Children's Mercy Kansas City Elizabeth J. Ferrell Fetal Health Center. She's actually the surgical director and performs both fetal and pediatric surgeries. She's going to chat a little bit about her role as a mom and at Children's Mercy. So, talk about your role at Children's Mercy and what you do on a regular basis there.
So first of all, thank you, Laura, so much for having me. I'm new to Kansas City, so I'm
Oh,
really excited to
welcome.
be. Thank you. I'm excited to be a part of Kansas City Moms Collective. So at Children's Mercy, I am a pediatric surgeon and I'm a fetal surgeon. So I have the privilege of taking care and operating on patients with congenital differences before a baby is born, during birth, and all the way up until adulthood. I also have the privilege of starting their fetal surgery program here, and that's been really incredible and a great experience.
Wow, that's amazing. Welcome to Kansas City. How do you prepare moms for an unpredictable pregnancy and birth?
So I recognize that I am meeting families, moms and dads, on the worst day of their lives. They just found out that the pregnancy that they were hoping for is not the pregnancy that they planned for. And so it's really making families feel comfortable, making families feel educated, making them feel like we're supporting them. We've got them. We're going to walk the road with them. We are going to make sure that they recognize that for us, the only right decision is their decision. And it's terrible that sometimes the first decision that families have to make for their unborn child is whether or not they're going to have fetal surgery. But we are here to hold families' hands through all of that. And that's just paramount for us.
And what do you enjoy most about being a pediatric surgeon then?
It's really the opportunity of taking care of the entire family. Kids are so resilient. It's so much fun to work with children, but also I get to take a child who may have had a poor prognosis when they're still in utero and potentially offer hope and completely change the course. And that can potentially change the rest of the child's life. And it's just humbling and it's such a privilege to be able to do that.
Wow, that's amazing. So what tips do you have? Because obviously being, the fetal surgeon, pediatric surgeon can probably be pretty stressful. How do you handle that and balance your career with being a mom?
It's tough, not gonna lie. So, I think for me, it took a long time for me to recognize that I'm not going to get it perfect every time. There will be dance recitals that I miss. There will be baseball games that I miss. But it's really being, for me at least, intentional about the time that I spend with my children. It's not so much about the quantity of time, but it's when I'm there, really being present, putting down my phone, wrestling with my son on the floor or putting on a dance performance with my daughter in the living room. So it's really being intentional about the quality of time that I'm spending with my children, recognizing that I won't be there for every moment of their lives. And,
Yeah.
for me also, it's my children have really grown to understand what I do at work and why it's important. And so at this point, like they get it. The mom guilt will always be there, and the mom guilt is so real. But when I have to run into work, we're about to sit down to dinner, and I have to run into work, my kids understand, and they even say like, "Oh, okay, you're gonna go help a baby,"
Right.
and then I come home from work, and they say, "How many babies did you help today?" So yeah, it's really it's important, I think, to instill that into them too, to know that if mom is leaving at dinner time, it's to do something really important and that, you know, I'll be back, obviously.
Sure, sure. Have you found any routines that help balance that life?
Yeah, so we moved here actually with my best friend's family. Her husband works with me and does research with me.
Oh, wow.
And, we don't have any family in Kansas City, but we call them our family. And
Sure.
so we have Sunday night supper with them every week. We alternate houses, and that really just kind of for us feels like it's family. Feels like there's a sense of normalcy, and I try to do everything I possibly can to be able to make it to those Sunday night suppers. It's also like we have so many calendars, and I also try to make it home for bedtime if I possibly can. And even if that means that my husband's going to keep the children up like a half an hour longer,
Mhm.
because for me, it's important to be able to see them. And also, for them to be able to see me before they go to sleep, even if it's for like reading a 5-minute story,
Mhm.
half an hour after bedtime. For us, that's worth it.
Yeah. Well, I love that. Sounds like you're doing an amazing job.
Trying.
What support systems do you rely on both at work and at home then?
So, it's interesting. My residency program director, he told me that in life, you're either the fighter pilot or you're the guy at the control tower. And if you're one of those, it's always going to be really hard to be the other one. And I've always kind of been the like boots on the ground, like doing things. So as my career has progressed, I've really, at least at work, started relying and delegating and prioritizing. And so I work with incredible nurses here, fetal surgery coordinators, obstetricians, partners. And so it's building that support system at work. Um, that's been really crucial to me being able to balance things. And then at home, as I said, we're new to Kansas City.
Mhm.
I got to move with my best friend, so that's been the best support system of all times, even if it's just having like, some popcorn and watching TV
Mhm.
on a Wednesday at 10 o'clock at night after both of our kids go down. But we're really, for me, it's so important to build that community and build the village both at home and at work. And we've been working really hard to do that since we've moved here.
So, with your busy schedule of being a pediatric surgeon and mom, how do you make time for yourself?
So I have to be really intentional about it. It doesn't come naturally to me. But, I recognize that if I make time for myself, I am more productive during the day. I'm a better mom. I'm able to spend more quality time with my kids. I'm able to get more done at work. So, I'm pretty extroverted, so I get energy off of being around people. So sometimes, I'll have some friends over after the kids go down to bed. Or I started taking a dance class. I danced growing up, and that's really been fulfilling for me. And so it's really just kind of being intentional to take those pauses and take those moments and recognize that, I need to recharge too.
Okay, and this is what I'm going to ask just off the cuff. What do you like about Kansas City so far?
Oh my gosh, we have loved it here. We've lived in several cities, and it's such a big, small city. I'll go to the store and see somebody that I recognize. And we've been Midwesterners our whole lives. We've moved around a bit, but I'm like a Midwesterner at heart. And people here are just so wonderful and so welcoming and so nice and, always willing to lend a hand. So that's been incredible. The schools here have been amazing. There's been so many things for my kids to do. Like we love going down to Union Station. They love that science museum there, the
Mhm.
children's museum. So we have absolutely loved it here.
Well, Kansas City is lucky to have you and helping families with unexpected surgical needs. So thank you so much for joining us and being here. We really appreciate your time.
Oh, thank you so much for having me.
At the Children's Mercy Elizabeth J. Ferrell Fetal Health Center, they provide specialized care for both mom and baby in the same place with maternal fetal medicine specialists, a level 4 NICU, pediatric specialists, and surgeons. You'll receive comprehensive and personalized support throughout every step of your pregnancy and birth journey.